Gua Sha is a Chinese therapy tool that looks like this, that is used to help stimulate microcirculation of the skin and the tissues underneath, which helps to promote blood flow and lymphatic decongestion. It's also used to help decrease chronic pain and for tissue healing. My name is Kelly, and I'm a physical therapist that specializes in lymphedema or lymphatic health, as well as oncology and women's health. And in this video, I'm going to review and discuss the Gua Sha tool, also known as a board, for lymphatic drainage and tissue healing of the face and the rest of the body. With the Gua Sha tool, clinicians will use a gentle scraping motion with or without massage oils for comfort. In its ancient history, the Gua Sha tool was used to help decrease inflammation associated with things like chronic pain and to promote healing. It can be used on various parts of the body, but it's most commonly used on the neck and the back, as well as the arms, the legs, and the face. Professionals can be certified in the use of the Gua Sha tool, and if someone is new to it, that's typically the best place for someone to start. Your clinician will start out gently and build up in intensity based on your specific needs while addressing safety. This tool can be purchased and used in the home, but you want to make sure that you get clearance from your doctor or your provider before you start using it. If done too intensely, the tools can cause redness and bruising. And although when you get it professionally done, you may also have the same side effects, in some cases that's considered normal. And if you're unsure or new to it, you want to make sure that you're not doing that same thing at home because it can lead to more swelling or further injury. As a physical therapist, we don't use the Gua Sha tool specifically, but it reminds me a lot of the tools that we use, which we call instrument-assisted soft tissue mobilization, also known as Graston or hot grips. I personally don't use any of the tools or instruments within 4 to 6 weeks after someone's had a surgery because I want to make sure that the skin and the tissue are fully healed. We also take a lot of precaution or avoid using the tools for those who are on blood thinners or who have a clotting disorder due to the potential side effects. Gua Sha tools come in various shapes and sizes. You will see smaller contours on some tools for certain areas or contours of the body, such as the ridge of the jaw or the nose or on the eyebrow. And the larger size of the tools are used for larger areas of the body, like the cheek, the back, the arms, and the legs. You will also see various types of Gua Sha tools. You will see some as jade, some as rose quartz, and again, they come in various shapes and sizes. So when you're looking to buy one or if you're looking at purchasing one for yourself, you want to think about the type you want and the size and the shape for whatever part of the body you're looking at using it for. I will place links for various options of the Gua Sha tools that you can purchase online, and I will go more in depth in another video on the instrument-assisted soft tissue mobilization that I spoke about earlier. So if that is something that you're interested in, be sure to subscribe down below to see when that video comes out. When thinking about using instruments or tools like the Gua Sha tool in therapy for soft tissue, we always start on an area of the body that we know is not as sensitive, such as the back or the leg. I don't know personally if I was new to it that I would go straight to something like the face that is a little bit more sensitive. I'd probably start on the arm or the leg that we know we can be a little more confident with, that is less likely to cause irritation. And again, I would always say it's best to talk to a professional so they can show what is the best technique for that individual or for that individual's needs. So if you're using the Gua Sha board or another tool for tissue healing or for chronic pain, I would use it differently for that than I would for something like lymphatic drainage. If I'm using it for tissue healing or pain, or someone has muscle tightness and restriction, that would be used a little bit deeper in a muscle area. So I know you won't be able to see on the back of the neck, but it's really common to use in this upper trap area where a lot of people will hold tension and stress. So you can see, I'm going to show you on the arm instead, is it would be small scraping motions in the direction that the muscle fibers will run. It's not wrong to do it otherwise in like a perpendicular area to the muscle fibers. Your therapist or your professional really know what each person needs based on what their tissue is like, and they'll adjust it for you. But in general, most people will go with the muscle fibers in these scraping motions in a certain area. So on the side of the arm, again, and the neck and the back, just to help relieve some of that tension and that tissue restriction. Now, however, if you're looking to use a tool for lymphatic drainage or decongestion, the lymphatic system sits right under the skin, and so you don't have to press hard, and we actually strongly encourage you not to press hard. So if we're looking at the lymphatic system of the head and neck area, you have lymph nodes that sit right around the collarbone or the clavicle area and the base of the neck, as well as on the side or below the ear. You also have some underneath the jaw and throughout the face as well, but the bulk of them are in these two areas. And so what we want to do first is to stimulate the lymphatic nodes in those two spots. And I would just use the hand for this because it's a little bit more tricky. I would just lay my hand flat and do small circles or large circles, about 8 to 10, around where those lymph nodes sit. And after you've done that base of the neck area, then I'd also go right below the ear and do the circles there. Again, about 8 to 10 of those around, or whatever someone feels like they need. If I feel like I'm getting a cold or getting sick, I'll also gently do it underneath the jaw. And then we'll go to the lymphatic vessels. So your lymphatic vessels run down the side of the neck, and if you were to draw a line down the middle of the face, they run from the middle of the face out towards the ear or below the ear, and the fluid gets filtered and detoxed through the lymph nodes of the ear, then going down to the base of the neck or the collarbone area, and then the fluid goes back to the heart. So then after you stimulate the lymph nodes, then I would use a tool really lightly. I'll use the long area here with small strokes downwards from the base of the ear down towards the base of the neck, and doing about 8 to 10 strokes down in each area. And again, you have a lot of delicate structures through here, so we're not pressing very hard at all. But if you want to work in towards more of the back of the neck, you have a little bit more muscle bulk here with the upper trap, and so some people feel a little bit more comfortable going a little deeper here, or a clinician or your provider will go a little bit deeper there if someone needs it, but working down. And then after you've cleared this area, then we can go back to the face and clear the face next. So I would start from the middle of the face, working out with the tool, so underneath the jaw, doing small strokes towards the base of the ear. Again, I would do about 8 to 10 swipes in one area or strokes in one area. And then you can work up, so going towards the cheek, working out towards the side. And I'm not pressing very hard, but working to whatever someone needs. And then very, very lightly underneath the eye and the bridge of the nose if someone were to have swelling or decongestion there. And a lot of people use the rose quartz or the jade because it is cooler stone, and so that feels good against the skin, especially if someone's kind of puffy or swollen in the mornings. And then for the forehead, starting in the middle and working out towards the sides, towards the base of the ear. So you can work with whatever contour you want, whatever feels good, or if you need smaller areas around the eyebrow, you can use a different contour. But again, everything is working towards the base of the ear. Once you're done with the face or whatever you want to be working on, then I would go back and finish down the side of the neck with the short or long strokes towards the collarbone or the clavicle area, nice and gently. You work into the back of the neck a little bit downwards too. And then once you get to the base of the neck, then I would go with one more set of large circles just to finish stimulating the lymph nodes. And that's how I would use the tool for lymphatic drainage, which is different than how I would use a tool for tissue healing or restriction or pain. If someone is looking at the lymphatic system for an arm or the chest or the leg, you have major lymph nodes in the armpits as well as the groin areas. And so everything is working towards those lymph nodes based on whatever area that you're working on. Gua Sha is an alternative medicine at this time, so there's not a lot of research out there showing what it can truly provide. However, it is really similar to the instrument-assisted soft tissue mobilization like the hot grips or the Graston like I talked about earlier. And those areas do have a lot of growing evidence on the benefits of using these tools for tissue restriction and for pain. That being said, there's not a lot of research quite yet with these tools using it for lymphatic drainage. So the majority of the research right now for the Gua Sha tool is anecdotal, but if it's safe and someone is cleared by their doctor or their provider to use the Gua Sha tool and they're using it appropriately, then yes, it might be a really great option for someone to help address their symptoms. So that's the general overview of what the Gua Sha tool is and how it might be used for something like tissue healing or restriction versus lymphatic drainage or decongestion. Like I mentioned before, I will go more in depth in another video on instrument-assisted soft tissue mobilization. So if you have any specific questions that you want me to include in that video, be sure to comment those down below and press the like button if you found this video helpful. We'll see you all next week for another video. Thanks everyone.